Hey, good weekend, everybody. As you can see, haven't shaven, hair's a mess. It's weekend time. Time for another video. So I wanted to talk about something I've said to a lot of patients over the years, and that is there's no suboxone for Xanax. And I want to talk about this group of chemicals called benzodiazepines. So benzodiazepines are a group of sedatives that go by the name of like Xanax and Ativan and Valium and Klonopin or alprazolam, lorazepam, diazepam, clonazepam, and they are extremely helpful for certain things. We would use long-acting versions of them to help people get through alcohol withdrawal and to keep them from having alcohol withdrawal seizures and then taper them off. People with severe anxiety that doesn't respond to less addictive medicines or habit-forming medicines. People with, all kinds of reasons, back spasms sometimes, etc. The problem is, as I mentioned, they're a sedative, and B, the longer you take it, the less they typically work, so tolerance is a problem. And then when you stop taking, anxiety, insomnia go right through the roof, and some people will have seizures if they're predisposed to seizures or their dose is high enough, whatever. So it can be really problematic. It's very difficult for people to get off of benzodiazepines when they start taking them for anxiety, because as soon as they stop taking them, their anxiety goes completely out of control. And so over the years, I've battled with this a lot. There is not an equivalent to suboxones for opioid, chemical dependency, opioid dependence. There is not equivalent drug for benzodiazepine dependence. And, I have a patient who tells me, whenever my wife and I get in an argument, all I got to take is a little bit of clonazepam and I'm good. Well, that's not dealing with, that's a chemical dependency. I mean, you're taking the drug so that you can kind of like, not have to deal with the fact that you and your wife are, not seeing eye. I don't know. It just, that's not what it's for, and so, getting emotional escape by using something that causes you to just not care about something, well, I mean, shit, that's the same thing that you would do with alcohol or opioids or whatever, soma, so that's not the ideal case. So while I do prescribe benzodiazepines to people, probably a lot of people, my preference is to use benzodiazepines to bridge somebody to taking a better, longer acting, medicine. For example, like let's say we're going to start somebody on venlafaxine, otherwise known as Effexor for anxiety. Well, probably it's going to take 10 to 14 days for that medicine to start working. So in the meantime, if they're struggling with anxiety, you may want to bridge them to the time that the venlafaxine works and then taper them off of benzodiazepines. The reality is that the longer you take benzodiazepines, the less they work. And I tell people this medicine will always break your heart. That the longer you take it, the less it works, the more anxiety you have. Then when you stop taking it, the more anxiety you have, and it's just another deal with the devil. And in some places, like in Scotland, I believe currently, they're having a real problem with benzodiazepine dependence in the same way that the United States is struggling with this, epidemic of opioid dependence. So it's a significant problem. Of course, Valium used to be called Mother's Little Helper. It's been used for a long time to kind of get people that sense of emotional escape. While it's effective, it's just not sustainable. It's the same true with any type of chemical dependency. I mean, smoking an oxy works great for a very short period of time, and then you don't deal with the problem, and then when you come back to the problem's worse, et cetera, et cetera. So So that's the same problem that I notice with benzodiazepine use. Plus, people have accidents all the time. I have this one patient who sees another provider, and I'm like, listen, you take way too much lorazepam. And, this particular patient has had a bunch of car accidents. And, he's like, well, it's the ADHD. Well, but taking a shitload of lorazepam certainly doesn't help you pay attention. And people fall downstairs and that kind of stuff. So, oftentimes when somebody comes in and they've had an accident or injury or that or whatever, in my head I'm thinking, that's the benzodiazepine right there. You're sedated. You're not paying attention. Your balance is off. You're clumsy, whatever. That's the side effect of these medicines. It can actually get people into, significant trouble. So benzodiazepines are certainly not benign, which is a problem because a lot of prescribers on this island in Kauai and nationwide prescribe them like they are. They don't check the PDMP. They don't check a pill count. They don't recognize that these medications result in significant dependency problems as well as accidents and those other things. And so they need to be used very, very cautiously, way more cautiously than I think currently the standard is right now, at least on this island. We had visiting physician come recently and took over a position at a clinic, and she got a hold of me. I was like, what is going on? Why are all these people on so much benzodiazepines? I'm like, I was like, I don't have a good explanation. It's been like that forever. I've called, I've commented. A lot of these patients are on suboxone. So if you looked at all, you would recognize, hey, this person's got a chemical dependency problem. Maybe I shouldn't be prescribing another sedative that acts just like an opioid. But, it's hard to change prescribers' behavior. And that's just not one clinic. That's multiple clinics. So it's certainly something that, I've been trying to, get on top of, try to manage, and then eventually things spin out of control. And then a patient lands in my office having taken, sometimes 2 different benzodiazepines from 1 or 2 different prescribers at extraordinary doses, and they're freaking out. Their anxiety is so bad, they can't sleep, they're jittery, they're in a mess. And there isn't, a buprenorphine, a suboxone for it. So we have to kind of cobble together something to, get their heart rate under control and to try to calm their nerves and to keep them from having a seizure and all this kind of stuff to try to, manage the problem. I prefer not to just keep writing for benzodiazepines because clearly that's, going to result in people not controlling the medication, etc. So this is just, something if you're yourself thinking, oh man, if I could just take Xanax a couple times a day, yeah, right? If I could just take something that can make all my problems go away, I want a new drug, that is really problematic. I don't prescribe Xanax to anyone. It's a terrible medicine. If you want to control anxiety, why would you want to control anxiety for like 4 hours? You want to control anxiety for 24 hours. You want something that's long acting, something like clonazepam. Also, clonazepam doesn't show up in your urine. So if I'm giving you clonazepam and you go pick up some Xanax from a friend and you come in, your benzodiazepine test is positive, and then I can be like, oh, well, maybe we should do this. If you're already taking Valium or whatever, then your test's already positive. I can't tell that there's a problem until a week later when we get the result from the reference lab, et cetera. So if I'm going to prescribe a benzodiazepine, it's almost always clonazepam. It's long acting. It helps me in the clinic determine when people are in trouble or not. If you're thinking that there's a reason for you to be taking a benzodiazepine, you should probably be taking another medicine, maybe in addition to the benzodiazepine. But if you have anxiety or whatever, just taking Valium or Xanax and not seeing a counselor, not taking a medicine that will work long term for your anxiety, eventually you're going to just need more and more and more Xanax or whatever, and here we are, in a mess. So I try not to dig new holes for people to fall into, because that's a lot of what I spend my time doing, is digging people or helping people out of these holes that they dug for themselves, oftentimes with the help of a doctor. So be very cautious. Say no. Say, listen, I got to cut off this medicine because it's detaching me from who I want to be. It's making me accident prone. It's making me whatever. People are not they're not the best versions of themselves, I guess is probably what I should say, when they're taking benzodiazepines such as Xanax, or especially the short-acting ones like Xanax. Very problematic. Anyway, some food for thought. Hopefully this resonates with some of you. Post a comment, ask some questions. Have a good weekend. Bye now.